Vocal fold polyp is a benign focal swelling of vocal fold that arises from the free edges of vocal fold at the junction of anterior and middle one third. And this is about 3 mm or larger in size. Usually they are unilateral but can occasionally be bilateral. Arises on the free edges of vocal fold commonly at the junction of anterior and middle one third. Etiology mainly phonotrauma like voice abuse, shouting, singing, and prolonged whispering or speaking. Acute trauma like coughing and intubation. Inflammation, post acute laryngitis or chronic irritation. Smoking and alcohol increases the risk of vocal fold polyp. Associated with hemorrhage into Rinke's space and hyaline degeneration, leading to reddish hemorrhagic polyp formation on the free edges of the vocal fold. Pathology involving polyp is localized lesion in Rinke's space. It can be sessile or pedunculated. It is gelatinous, translucent, or hemorrhagic in appearance. On microscopy, hyaline degeneration of basement membrane and capillary proliferation with hemorrhage or fibrin exudation is seen inside the polyp. On clinical, hoarseness of voice is the most common presentation. Altered voice quality like breathy voice, rough voice. Vocal fatigue, strain on speaking, global sensation or throat discomfort. Large polyps may lead dyspnea, stridor, and episodic airway obstruction. For probable diagnosis, you required only 90-degree telescopy showing reddish soft lesion unilateral on the anterior and middle one third of the vocal fold. DD may involve vocal nodules. Mostly they are bilateral, smaller and symmetrical. Cyst may be submucosal cyst, round and less mobile cyst may be DD. And early carcinoma, in that case, this polyp will be irregular and more vascular. Management include first is conservative management like voice rest, vocal hygiene, and smoking cessation. Voice therapy important to prevent recurrences and treat associated conditions like allergic rhinitis, LPR, and infection. Surgery is indicated if these lesions persist more than 6 weeks and larger in size that obstructing the airway and professional voice needs urgently. Then you can go for microlaryngeal surgery under general anesthesia. Technique may be cold steel, microdebrider, coblation, laser excision. It doesn't matter. Your surgery should be precise to free this vocal polyp from the this vocal epithelium. Precise decision or dissection to remove this polyp is very important. You can use laser that is very accurate and precise CO2 laser. You can apply CO2 laser and this free this polyp from the vocal fold without damaging the surrounding mucosa. Prognosis is good with the surgery, but you have to give voice therapy and prevent recurrences. You should avoid phonotrauma and smoking should be stopped.